Hello, it's Dr. Rhonda Johnson, and today is Wednesday, April 21st, 2021. And today my message is called, It's Time to Wake Up. And before I begin, I have a favor to ask you. Will you please share this video? In my mind, this is one of the most important messages that I am sharing in a long time. So please share on your social pages. Please share with your friends. So I'm going to be talking about young people and the coronavirus pandemic. And there's so much misinformation that young people are being fed around this pandemic. And so I'm just going to phrase them as what I've heard in doing a lot of the community education that I have done recently. And so this first is a statement that I hear young people make. I am young and healthy. Why should I get the vaccine? If I get COVID, I'll get over it. Well, here's the truth. Young people are filling up the hospital beds. Young people can get very sick. Yes, young people can die, and young people may get over COVID. They may not get over COVID, and they can have lingering COVID symptoms when they recover. That's reason enough to get the vaccine, young people. You know, there was a report that came out recently from the Black Equity Coalition, a group of health and human services professionals here in Allegheny County, Pennsylvania. And although this information is specific to Allegheny County, the truth is this is happening all over the United States. So here's the facts. The 14-day test positivity, that means coronavirus tests that are positive, for Black residents in Allegheny County has increased by 17 percentage points in the last 2 weeks. 38% of the tests are positive among Black people who are being tested. That means in communities of color, there may be, more than 1 out of 3 people who are testing positive for coronavirus, which means that the virus is ever present. And of course, what follows the testing positive is the sickness, illness, and hospitalization. So even more concerning here in Allegheny County, the Black hospitalization rate from coronavirus has skyrocketed. Right now, Black residents of Allegheny County are more than 6 times likely to be hospitalized than white residents. This is right now. And the positivity rate in the Black community has been higher than it has been in the county at any point during this pandemic. So the week of April 4th, Allegheny County recorded the highest number ever of hospitalizations for Black residents under 30 years of age. The bottom line is, folks, young people, you are getting sick with coronavirus. You are getting hospitalized. The coronavirus makes you feel like you're suffocating, like you can't breathe, like you can't get any air. Please, folks, please take this seriously and get the COVID vaccine. The way you prevent getting COVID is to be vaccinated. Next myth is that this vaccine is too new. Well, the truth is that the vaccines use existing technology. The vector vaccine, Johnson & Johnson, AstraZeneca, use a vaccine technology that has been around for years. Now, the messenger RNA vaccines, the Pfizer and Moderna, they've also been developed at least 5 years ago. They were developed for the Zika and the Ebola vaccines. They just weren't widely used. Folks, please remember, we have a new pandemic going on here. This is the pandemic of variants. The most common variant is this UK variant, the so-called B117. It is different than the original strain of the SARS-CoV-2 virus. It's causing more serious, more infection, and younger people are getting infected. So we're dealing with a new germ out there. It's still the same coronavirus, but it's far more deadly and transmissible. Another myth is that if young people get it, they'll have a mild case and recover. The truth is that is not happening. Plenty of young people have turned into COVID-19 long haulers. They're suffering chronic fatigue, chest pain, shortness of breath, brain fog, months after their infection. At least 30% of people who had mild COVID infection have symptoms up to 9 months after infection. Another problem, of course, is that young people are transmitting this coronavirus. You know, a lot of the infection currently in the United States is the spread is happening among younger people, a group that's moving around, relaxing, getting infected, not wearing the mask. Young people, you still need to take precautions. Coronavirus is your disease right now. It is not a disease of the elderly. It is a disease of young people. It's going to take away your healthiness, your vitality at a time in your life when you should be not dealing with chronic diseases. Folks, get the vaccine. The vaccine is safe. You don't need to be concerned about long-term side effects. The safety has been proven. I know we had to pause the Johnson & Johnson vaccine, but that was a good thing until the scientists know who's at risk for these blood clots. Trust the science. Fear the virus. Don't fear the vaccine. And please share this message to the young people in your lives so that they can have an alternative message instead of the message that is so strongly against vaccination. Young people are our future, and we want to keep them around, and we want to keep them healthy. This is Dr. Rhonda Johnson. My views are my own. I hope this information will be shared. And as always, have a blessed day.